Let's talk about Ayurvedic care for tonsillitis or inflamed tonsils. Itis means inflammation, so tonsillitis means inflamed tonsils. Here's a picture of what tonsillitis looks like. And notice the red, inflamed, swollen tissues on either side of the back of the throat here. And you see these white patches as well where the infection is. So this is what tonsillitis looks like. Tonsils are soft tissue masses at the back of the throat, and they're very similar to lymph nodes. And in fact, tonsils are a part of the lymphatic system, and you see there's 3 of them here: the pharyngeal tonsil, the palatine tonsil, and the lingual tonsil. The palatine tonsil is what we saw in the previous photo, and the pharyngeal tonsil is high up in the back of the throat. It's also known as the adenoids, and you see here that it's this tonsil is really guarding over the nasal cavity. The palatine tonsil is sort of guarding over the mouth, and the lingual tonsil over the mouth as well. So lingual just means tongue, so the tonsils at the underside base of the tongue. And these tonsils have little crypts in them, and food and mucus can get stuck there, and that's what causes them to get infected. The purpose of your tonsils is to help your immune system detect bacteria early. So it's really a part of an early detection system for any pathogen that enters the mouth or the nose. If you're eating food or even breathing and some pathogen falls on your tonsils, then your immune system gets to detect the presence of that early and start mounting a defense. Acute tonsillitis is when bacteria or virus are currently infecting the tonsils. That causes swelling and sore throat. Chronic tonsillitis is when this happens over and over again. So what are some remedies for tonsillitis? Well, generally you're going to go to the doctor if you have an acute case. So if your tonsils are infected right now, go to the doctor. But if it's chronic and just tends to happen over and over again, and you're wondering what and how do I address this and prevent, what's a preventative option for me? Well, it's gonna be the same as the preventative options for swollen lymph nodes, and that's generally a kapha pacifying diet, avoiding sweet, rich foods. That's what aggravates kapha. But the sweeter your blood is, the more likely bacteria will find your body a favorable environment and infect your body. So a kapha pacifying diet is the best preventative technique. You can also gargle with antimicrobial herbs if it's a palatine tonsil infection. That's some brief notes on tonsillitis.